In this video, I'm going to talk about how I treat patients with issues with fertility. First and foremost, it's important to find out if patients have actually been having intercourse on the right day of a woman's cycle. Some women actually ovulate at day 17 if she and her partner are trying at day 11, 12, and 13. They're missing the window entirely. So then I ask a patient to use an ovulation predictor test for 3 months to get a better idea of when in fact she's ovulating. After a few months of being more aware of when she's ovulating, if she's still not pregnant, at that point it makes sense just to have a workup by a doctor to make sure she's actually ovulating, to check FSH levels, make sure they're low enough, to check her fallopian tubes, make sure they're not blocked. Also in terms of the male, to make sure he has a good sperm count, also good motility, and also that there's good morphology, that the sperm is actually shaped in a way that makes it easier for conception. So if there is an issue with any of this, of course it makes sense at that point to go to a reproductive endocrinologist, or because further medical help is needed. But so often for many couples, they get checked out, she's fine, he's fine, and really the issue with fertility is that nobody can figure out what the problem is. They're having intercourse on the right day, his sperm is fine, her ovaries are fine, her endometrium is thick enough, and it just is not happening. And that is the case for so many people, so many couples, and that is so frustrating. So many of those couples come to see me. Also couples who are also going through IUI and IVF come to me. But so often it's patients who are just trying to go it alone, go it on their own, and try and figure out what they can do holistically instead of go to reproductive endocrinologists. So one thing I do for these couples, and I mostly see the woman, and why that is a whole other conversation, I suppose. Probably because the men don't want to come in and talk to me about their sperm. However, for the woman, even obviously conception happens inside the woman, but we need her to be strong enough to be able to get pregnant, but also the real issue is carrying a pregnancy to term. So I try and work on increasing the endometrium to help implantation be more successful. I try and reduce her stress, and then also, at the point where she gets pregnant, I see her weekly to try and reduce the chance of miscarriage. Thank you so much for watching my videos. If you want to learn more, please feel free to visit my website, which is catherineprice.net, CATHERINEPRICE.net. Also on the website, you can sign up for my mailing list, and you will receive more information about topics we've covered.